A lesion of which of the following brain regions is most likely responsible for this patient's condition? Broca's, Wernicke's, arcuate, angular, or primary auditory cord. Okay. A 60-year-old man presents with difficulty repeating spoken language. His comprehension is intact, and he is able to speak fluently with occasional paraphrasing errors. His reading and writing abilities are preserved. A lesion of which of the following brain regions is most likely responsible for this patient's condition? So he has difficulty repeating spoken language. His comprehension's intact, and he is able to speak fluently with occasional paraphrasing errors. This is interesting because Broca's aphasia, you usually have really difficult time speaking, where Nikki's is you just talking without making sense. So I don't get either of that from this.
Okay.
At first, I saw difficulty spoken languages, repeating spoken languages. Um, okay, I don't think it's the primary auditory cortex either. So it's between arcuate fasciculus and angular gyrus to me.
Okay.
And repeating spoken language. I honestly don't know the difference between them. I think that arcuate fasciculus is like the connection between. That's kind of how I think about it. The connection between Broca's and Wernicke's, and if that's like an issue, you can't repeat language. So I probably would go with arcuate fasciculus, but I
Okay.
don't know.
Final answer.
Yes.
Okay, yeah, let's talk about it, right? So, definitely for sure, Broca's and Wernicke's, you got to know, right? And so Broca's you can understand, but you're having issues with speech, right? And remember, Broca's patients or people with Broca's aphasia have a lot of frustration, right?
Yep.
Because imagine understanding and then realizing that you can't, communicate. Then these people get way more frustrated, and then Wernicke's you can talk and keep talking, but it's you can't understand, and also on top of that sometimes you just kind of fluently talk but it's all gibberish, right?
Hmm.
So it doesn't
Hmm.
really fit, right? So you need to pick something that's a little bit less severe, right? Arcuate fasciculus, right? Difficulty repeating spoken language with intact comprehension, fluent speech while preventing reading and writing capabilities are consistent with conduction aphasia, which is caused by the arcuate fasciculus, which connects Broca's with Wernicke's, angular gyrus, right? This is involved with reading and writing. Damage to this gives you alexia and agraphia, so you can't read or write. And then primary auditory cortex, right? Processing of auditory information. So then, you can't sound localize, you can't discriminate sound. So that makes sense, right? You've messed up kind of how you interpret sound.
Yeah.
So
Yeah.
so yeah, so those are a little bit, obviously neurology question here, but they'll ask you sometimes. Obviously, I would say that this is a more difficult question, right? Because they usually ask you about Broca's and Warnicki, so those are your high yield things, and so this is a little bit like kind of medium, right? Yield, not as
Yeah.
high. So
And so
good,
the whole sentence of his reading and writing abilities is just to make you know this is not angular gyrus, right? That
exactly,
was the whole point. For me, I didn't really know what that meant, but now I would know what that means. Okay, cool.
exactly, exactly.